Well, I recently had knee surgery. I'm going to show you a little picture here of what my leg looks like. I'll tell you more about that as we go along, but this video is actually going to be a little bit about my experience in a hospital during COVID times. And I also want to share how that relates to a very important leadership quality that research shows best leaders have. And if you don't have this quality, or if you don't think you have this quality, you can develop it with practice. Hi, I'm Luci Gabel, Leadership Optimal Performance Coach. The conversation about COVID right now is heating up. We're getting close to the holidays, and large parts of America are starting to become more restrictive about what can remain open. And there's a lot of confusion around that, like what is the benefit, So from my recent experience in the hospital, I wanted to share some of my insights, and I think it could help you a lot in terms of understanding what the big picture is here. Now, I've known that I've needed this surgery since March, but because of COVID, I couldn't go to the hospital at first, and I didn't feel comfortable going to the hospital. Then we had a good lull finally in COVID in October. And the news was we might surge again in the winter, so I decided to go the first week in November. That's not the only way that COVID impacted my surgery, though. The thing is, as we know, hospitals are being quite overwhelmed with COVID right now, and they're understaffed as well. So my experience in the hospital, people tell me, was not the average experience or what people normally get when they go into an outpatient clinic for surgery. I got into the hospital at 8 o'clock. I waited in the waiting room for an hour. And this is my first surgery, so I was quite nervous. That didn't help at all. Just kind of walking back and forth, literally. I was walking back and forth in the waiting room because I was nervous and I need to get rid of nervous energy. So they take me back at 9 o'clock. And I'm passing all of these people. It was like a row of beds with basically sheets hanging from the ceiling to separate everyone. And everyone was just laying there, kind of out of it. It felt a little bit like a factory. I got IVs put in my arm and a blood pressure cuff around my other arm. And I was basically hooked up to things until about 1 o'clock in the afternoon. So this place was obviously understaffed. I was waiting much longer than you're usually waiting in an outpatient room, and hooked up to a bed, where I couldn't move around. I have to stay pretty still. For me, someone that likes to move, that was the most uncomfortable thing. I didn't have a watch on. I didn't have my phone, nothing. So I couldn't tell what time it was. I was going in and out of being faint because I couldn't have eaten. I couldn't have eaten since the night before. So I was feeling really lightheaded. I thought they gave me anesthetics already when they actually hadn't done anything. I had signed all the waivers that the doctors and nurses gave me that told me the absolute worst things that could happen during and after surgery, where I could potentially die. So all that was basically what I was left to think about, laying there by myself with no one to comfort me. Because during COVID time, you can't have someone accompany you in the room, which you would otherwise. And nurses would come by and ask how I'm doing, basically in passing. How you doing? And I would have to say fine, because really there wasn't much wrong with me. And when I needed someone, I needed to yell out. Sometimes no one was there and no one heard me. I can't explain the way that feels. It feels like you're nothing, like you're invisible, like you're fading away. And I started to feel weak and helpless because I kind of was. This is me in a healthy state, in a very strong, healthy state. I couldn't imagine if I were actually sick, how awful an experience that would be. If you had a heart attack, if you had cancer or anything else serious happen to you, it would be tough. And even worse, I couldn't imagine how if I had something like COVID and I were in a COVID ward that was overextended, where I was having a hard time breathing, seriously not sure if I was going to die, having nobody near me to hold my hand or to help me to think about something else besides possible death. having the doctors and nurses be so busy that they can't help me or talk to me. And so here is how it transfers into the lockdowns and the closures, what we're moving into this holiday season. It's because the hospitals are already heading towards the brink. So my little peek into the hospital life right now hopefully will help you to understand what we're trying to stop from happening. When you see doctors and nurses on the news basically in tears crying about how COVID patients died with no one around them. And even if you feel like COVID's not going to affect you, or if you did get affected, you probably wouldn't have a very serious case. This is about feeling for other people, the people that are going to be affected and going to have a terrible time if they have to go into the hospital and possibly die in a terrible, sad way. It's up to us to stop the spread. And we know that it's highly possible that we could have this virus and we don't know it, and we can spread it to someone else who will end up in the hospital. We also have to think about the people that are working in the hospitals that are overwhelmed, and we need to do our part to help cut down on the numbers of cases and illnesses in general for now. So let's talk about that leadership skill that research says the best leaders have. Empathy is when you can imagine how someone else is feeling. You can actually put yourself into their shoes and feel their pain. It doesn't mean you have to cry when someone tells you a sad story, but it does mean that you're willing to open up and feel pain or feel loss or feel the fear when someone else is feeling it. And that helps you as a leader to help others better. It helps you to understand the people that you're leading, and it helps you to make better decisions as a leader when you can really take into account what other people are going through. It's definitely something that you can develop, basically just practicing. It's like when you're watching a movie, when you're sitting at the big screen and you're feeling the sounds and the movement coming towards you. It's almost like you're in that picture. Well, that's what we do in our brain when we're listening to someone talk about their own story. We put ourselves in their movie and feel all the feelings. And then we can have a better understanding about what they're going through. And if you want to practice that a little right now, just rewind this video and listen to what I say about how I felt in the hospital as a strong person, and maybe even put yourself in a COVID patient's position in a kind of a hospital situation like that. If you like this video, click like. If you have any comments, put them down below. If you think this will help someone else, please share this video. And if you want more videos from me, subscribe. Have a healthy, happy week.